So, doctor, what are the causes of asthma? There would be some intrinsic and extrinsic factors. So, if you could highlight on those.
So as you see and the attention being put on the environment. So this is one big reason why the so highly polluted environment that I think especially of the NCR, and I'm very glad at least now we've been able to bring some focus. Different governments I don't think they've got it, but they're at least trying to
Right.
bring some sort of. So if you have that degree of allergic environment, that also contributes, and that's a very strong intrinsic extrinsic. But having said that, some of the pristine and the most cleanest environments in the world have very high prevalence of asthma. So environment itself is just one bit of this complex. It is like any other chronic disease where different reasons, different pathways contribute to the problem.
Okay.
So if you look at UK, Australia, Midwest and the US, these are the hotbeds of asthma. So it is just not the cleanliness of the environment which is the sole factor. There's a lot strong genetic reason for it. How we've not been able to completely, we know there's a gene, Adam gene 23, but beyond it, I think it is not dictated by one particular gene pattern. Multiple gene patterns contribute to it. And there is also how, in the pregnancy, how the mothers feed. A lot of those things again, but these are all hypotheses. We don't have a clear understanding as to, there is an inheritance pattern, but there is not clear, so multiple reasons.
Doctor, you have practiced in the Western world as well as in India, and you've been practicing for a decade. Do you see any specific causes that happen in pristine environments and any specific causes polluted environments in India?
Yeah. So this particular thing is called hygiene hypothesis. This is a well-established hypothesis, not absolute. So where they say if your body's immune system has got nothing to do, and the environment is pristine, there are no parasitic infections. What your body's immune system goes is it just tends to fight against its own sort of intrinsic allergen. So it then goes from Th1 or to a Th2 response. So that, and therefore creates diseases like autoimmune diseases and asthma. So that's the reason, and we know for sure. And this is an explanation as to the high reason of asthma in these environments.
Right. Doctor, can asthma be hereditary in nature?
It is like diabetes, but there is no clear, we don't know if the father and the mother, and I get asked this question every day, is my son or my daughter, there is increased likelihood, that's all I can say, whether in what proportion would the kids, we don't have a autosomal dominant or autosomal recessive pattern, so yes, there is an increased risk of having asthma in the family.
So typically, how do people identify whether they're suffering from asthma or not?
Yeah. So the symptoms would typically start with young, you have these kids who will have breathlessness, episodes of breathlessness or cough. It's very hard in the early childhood to say whether the kid has asthma. They have mostly, it is labeled as, they have small airways. Anything in the airway will cause breathlessness. So that's labeled as bronchiolitis, and it should not be. So as they grow up, many kids in their adolescence will grow out of asthma. Some will not. We don't exactly have a handle on who and who will not grow out of their asthma. So in India, typically people put it to homeopathy, or they went to Hyderabad and got a fish and therefore they grew it.
Yeah.
Actually, the reality is it is the play of these hormones and the adolescence which pulls them out of the asthmas. And then you have people who will have adulthood asthma. Now we are seeing a lot of late onset asthma as well. Now people who have late onset asthma, the ones who have had childhood asthma, and then the asthma has come back for whatever reason in the late.
Right.
So, and the other thing is that if you will never have a patient of asthma saying last 20 years I've had the asthma for this severity. It has its own waxing and waning pattern that we again do not completely understand and completely dictate. All you can do is to take your medications well, understand your disease, they can increase your chances of having increased the disease-free intervals. And people put it, I went from Pune to Bangalore, my asthma improved and I went back and this. So they'll correlate to one thing or the other, but the reality is that it is a disease which has a waxing. And that's the big challenge as well.
Okay.
Think about a chronic disease like diabetes. One day it is there and then the other day it's not there. So our patients, when they improve, so some then what we say is escape the net forever. We never see them back till they are so unwell that they have to come to us. So compliance becomes a big problem.
So, doctor, I mean, as you say, there is no hold on a specific age bracket or specific, demography of people who are more prone to asthma. Is there anything that have been found
So it's
out?
again a disease, as you know, because it has a genetic component, inheritance. So in the younger age group, so it is very. One has to be careful to label a new asthmatic after the age of 40. They say, but again, these are getting with increasing level of pollution or environmental factors and whatever other reasons that we are seeing new and new asthmatics being labeled later in their age group. So
Right.
again, we don't completely have a very good scientific explanation why, because the kids, if they have atopy is this tendency of having increased sensitivity to different allergens.
Right.
So atopy will manifest with the baby having rashes or a lot of other allergic symptoms, and therefore have increased chance of having asthma. But there are other pathways as well which lead to this.
Doctor, interestingly, I'll come to the question on the kind of research worldwide which is happening in this particular area. I mean, we getting to know from you that there may be very many causes, and we're still not certain about the cause and the effect. Now, from this point of view, would you highlight on the emotional stress and the linkage of it to asthma?
There is a clear relationship. Patients who are asthmatics, if they are undergoing any episode of stress, it triggers asthma. Again, you've seen this in Bollywood a lot of times, that there is an emotional situation that and thanks to Bollywood, they've made our job very difficult in terms of how they portrayed the inhalers and their whole thing. I think they've
Right.
and that's one big grudge that we have with them. They made our task so difficult, and the sort of the myths they've created about the addiction to inhalers, and and that's all the reason that if all the movies so far have made
Right.
it's actually not true. Most of it what is portrayed in the movies